This is called the NOVA trial. The NOVA trial was an international study, randomized phase 3 study. Was actually led by the NGOT group. It's a study trying to answer the question of whether using maintenance PARP inhibitor, in this case the PARP inhibitor niraparib, improves progression-free survival, and then there's a number of other endpoints: overall survival, time to first subsequent therapy, chemotherapy-free interval, and a number of quality of life measures as well. But the main question is, does use of what we call maintenance therapy following chemotherapy for patients with recurrent ovarian cancer that's considered sensitive to platinum improves survival endpoints. And it's an interesting study in that it allowed really any ovarian cancer patient who had high-grade serous or high-grade endometrioid tumors, irrespective of whether or not they had a germline BRCA mutation. But within the main study, there were actually 2 independently powered studies. One study was for patients with a known germline BRCA mutation, and then they were randomized in a 2-to-1 fashion to niraparib or placebo. So patients could get really any sort of platinum-based chemotherapy that their physician felt was the best choice for them. They had to either be in a complete response or in a very, very good partial response, meaning they had less than 2 centimeters of visual disease on CT scan. And then they were randomized in this 2-to-1 fashion to placebo or niraparib. And then the other kind of independently powered study was the same design, 2-to-1 randomization for patients without a germline BRCA mutation. And then within that group, there were a number of exploratory studies done within certain subgroups.